About SLE. SLE patient is a young female, and we have to know a lot of clinical features. You can have a malar rash, and also it can include the bridge of nose, but the nasolabial fold will be spared. In seborrheic dermatitis, nasolabial fold is involved. So here it is having a raised margins. Margins are raised. And it is photosensitive also. Photosensitive. In the hair, there is alopecia. Alopecia. In the skin, there can be small lesions. Can be psoriatic or DLE, discoid lupus erythematosus. So the acute manifestation is malar rash and chronic manifestation is this DLE. Next, in the mouth, oral aphthous ulcer. Then involves the heart, lungs, kidney. So joints. There is serositis. Serosa of each and every organ is involved. So it can cause pericarditis and pleuritis. So in the heart it can cause endocarditis, Liebman sac endocarditis. It is sterile vegetation mainly in the lower aspect of the leaflet. And next is the kidney, that is lupus nephritis, nephritic syndrome, hematuria, cola colored urine, dysmorphic RBC, more than 5 RBC per high power field. Hypertension can be there. So lupus nephritis has got 6 variants. It's very easy to remember, 6. And the most common is the 4th one, diffuse lupus nephritis, where more than 50% glomerulus is damaged. Immunofluorescence studies, you get full house effect. All complements are deposit. Next is joint pain. Joint pain, it is any joint can get involved, and it is always you have more than 2 joints will be there. More than 2 joints. At least 2 joints, that's more than or equal to 2. And it is non-erosive arthritis, there is no erosion. Then next important point is about brain. Cognition defect. There is psychosis can occur, and the antibody related to that you can remember P, anti-ribosomal P antibody. Then anemia can occur, that is normocytic normochromic anemia, autoimmune hemolytic anemia, and antibody against erythropoietin. Immunological, the most specific antibody. So in the body of this patient, nurse took a blood sample, took a blood sample from here. So that blood sample went to the lab. And after assessing that blood sample, they found that there was a lot of antibodies present. The most specific is anti-Smith. You can have anti-nuclear antibody, many other antibodies. But the specific one is anti-Smith antibody. So, what is the most common cause of death in SLE? It is renal failure. So, it is the renal failure that can occur. So, you can have criteria for SLE. SLE criteria is like you can have clinical and immunological. You should have at least one clinical and one immunological. 4 features should be there. 4 with at least one clinical and one immunological. Clinical, whatever we have said right now. Immunological means ANA, anti-Smith antibody, anti-nuclear antibody, direct Coombs test, like that. The treatment is actually steroid. In pregnancy, you give hydroxychloroquine. Next is APLA. APLA means anti-phospholipid antibody syndrome. Anti-phospholipid antibody syndrome is APLA. We have to know about the primary APLA and secondary APLA. Primary APLA means it is only APLA. Secondary means associated with something, SLE. In APLA, you have clinical criteria and lab criteria. Clinical criteria means there will be thrombosis in the blood vessels. This is the blood vessel. You have thrombus. So, the baby not getting blood, it will lead to abortion or premature birth, pregnancy, morbidity. And antibody related to that is anti-cardiolipin antibody. Or lupus anticoagulant. So these are the important points regarding SLE. SLE, you should know this picture. Then this is the clinical and at least one clinical and one immunological criteria. Then steroid. APLA is associated with SLE, primary and secondary. Secondary APLA is associated with SLE.